Madam Speaker, as I begin my comments here tonight, I want to share a note, and a sad note that I got from a constituent of mine only a couple months ago. Daniel Paul had written me, sadly, with the news that his father, Gordy, 65 years old, a resident of Cornwall, SD&G area, was scheduled to come into my office a couple months ago for some help. Unfortunately, before he was able to fulfill that appointment, Daniel let me know that tragically his father took his life. I want to share an email that I exchanged with Daniel. I mean, he had reached out and he asked and said, Eric, I would really appreciate it if you could share his story to highlight the absolute crisis we are facing in this country. This would greatly help our family heal if his story could be used to shed light on the countless others still suffering today from affordability. Daniel, I want to give my condolences here on the floor of the House, as I said I would do, to you, to your wife Amber, and to your 5-year-old daughter Sophie. You've lost your father, father-in-law, and grandfather in circumstances that I can only imagine have been extremely difficult for you. It's important, Madam Speaker, and why I wanted to do this for Daniel and their family, is to let them know that there are members. At the end of the day in this House, there are members every day that are working to help those who are suffering, whether it be the affordability crisis we face, the mental health crisis we face, and getting, I think, optimism and hope for Canadians. So Daniel, I want to keep my word as I have, give my condolences to you and your family, and continue to fight the good fight in your father's memory. Madam Speaker, I had the opportunity a couple weeks ago to ask a question about the radical drug policy this Prime Minister and the NDP in British Columbia, with the support of the NDP, of course, here in Ottawa, propping up this Prime Minister, when it came to the decriminalization, frankly, the legalization of using hard drugs in public spaces in British Columbia. It was this Prime Minister's judgment and the coalition partners that for years they could have rejected the pitch from the BC government on this aspect, but instead they approved it. And finally, after the pleas of the BC NDP government, which just happens to be facing an election later this year, and more importantly, the horror stories that have been emerging from every part of the province about the disaster the Prime Minister's decision was to exempt from the criminal code use of hard drugs like crack and meth, fentanyl and opioids in public spaces. I want not just to use the words that I've shared here to date, but I want to share from news articles. It was the CBC, of all things, of all media, that covered on April 15th when the Vancouver Deputy Police Chief Fiona Wilson testified here at the House of Commons Health Committee about how that pilot and how that our Prime Minister's decision to decriminalize and allow hard drugs in public spaces, she said, quote, "It is limiting police response to problematic public drug use, including inside hospitals and at bus stops." Quote, "In the wake of decriminalization, there are many of those locations where we have absolutely no authority to address that problematic drug use because the person appears to be in possession of less than 2.5 grams. And she goes on to give a startling example. So if you have someone who is with their family at the beach and there's a person next to them smoking crack cocaine, it's not a police matter. What extremely poor judgment on the part of this Prime Minister to agree to the BC NDP request, just as complicit as they are on this out-of-touch WACKO policy, as we've mentioned before.
L'honorable secrétaire parlementaire.
Honourable Parliamentary Secretary.
Thank you, Madam Speaker. The overdose crisis is one of the most serious and unprecedented public health threats in Canada's recent history, and it is impacting communities across the country. Our hearts go out to the individuals, families and friends affected by this public health crisis. Dans le cadre de son approche,
As part of its comprehensive approach, our government continues to support efforts to divert people who use drugs away from the criminal justice system and towards health and social services. This approach reduces immediate harm and helps people find appropriate support, including treatment and recovery, while ensuring the safety of our communities. We amended the Controlled Drugs and Substances Act to encourage police and prosecutors to consider alternatives to charging and prosecuting individuals for drug possession offenses.
Mean that individuals can avoid being criminalized and get the help they need to address underlying issues. This strategy encourages a public health approach while making sure police have the discretion to move forward with criminal offenses when there are risks to public safety. Furthermore, in August 2020, guidelines issued by the Public Prosecution Service of Canada directing prosecutors to consider alternatives to prosecution for the personal possession of drugs, except in the most serious cases where public safety concerns arise. In 2021, the Government of British Columbia requested the launch of decriminalization pilot project to help address the overdose crisis in the province. BC has asked that we make amendments to its project, and we have granted BC's request to prohibit possession of controlled substances in public spaces. Everyone deserves to feel safe in their communities. Law enforcement also needs to have the tools necessary to address issues of public safety while continuing to take a compassionate and public health approach. From the outset, we've been clear. BC's exemption could and would be adjusted if needed. We will continue to work together and respond to what is actually working on the ground. We will continue working hand in hand with all of our partners, including provincial jurisdictions, law enforcement, Indigenous communities, people with lived and living experience, and municipalities across this country every step of the way.
There is no one-size-fits-all solution to this crisis, and it requires a global response. We're working to ensure that Canadians have access to a full range of support strategies to help people access prevention, harm reduction, treatment, and recovery services, the services and supports they need, when and where they need them. It's not one or the other, nor one against the other. We need a full continuum of care. Last week, I participated in the Health Commission's traveling study on the overdose crisis. All parties were represented, except the Conservatives. They were only there for half a day. Well, because the Conservatives refused to look at the evidence, they lash out with their ideological approach. Budget 2024 announced $150 million over 3 years to help municipalities and Indigenous communities quickly access funds to mobilize efforts and meet their urgent needs to reduce harm and save lives now.
The government remains committed to addressing substance use and addiction as a health issue. All partners must work together.
The honourable member for Stormont Dundas South Glengarry.
And it gets bad in hospitals. It's the BC Nurses Union that confirmed, was the president, where she said the maternity ward of the Victoria General Hospital is now equipped with a special device to detect harmful particulate matter such as smokable drugs. A light goes off to warn healthcare staff that potentially harmful substances are in the air so they can wear a respirator for protection. That's what happens when this Prime Minister and the NDP and Liberals got together for their radical drug decriminalization plan. My follow-up question, the key is here. Will the Liberals and the NDP support our Safe Hospitals Act, our common sense conservative plan to make sure these types of experiments will never be allowed in hospitals again, to protect our healthcare workers, and most importantly, a second important key part the government did not address in that first part is, will they rule out ever expanding this type of failed experiment anywhere else in this country? Yes or no?
The Honourable Parliamentary Secretary.
Merci, Madame.
Thank you, Madam Speaker. And we'll continue to work with British Columbia, the other provinces and territories, and all our partners to meet their specific needs and to support public health and public safety.
Enforcement partners have been clear. They do not want to arrest people for personal drug possession, but rather they want the necessary tools to address issues of public safety. They support a comprehensive public health approach to addressing substance use harms, where they can redirect someone away from the criminal justice system to available and accessible health and social services. L'approche de notre gouvernement.
Our government's approach to dealing with this crisis is collaborative and comprehensive. It includes measures that are innovative and which are necessary to save lives, follow up, and make the necessary adjustments.